Good afternoon, Joint Chiropractic employees. My name is Bernard Rubenstein. I want to welcome you to your 2025-2026 United Healthcare Open Enrollment. Looking to enroll or make changes to your United Healthcare benefits? Now is the only time of the year when you can enroll or make changes to your healthcare plans. Today, I will be reviewing your United Healthcare choices, how your program works, who's eligible, review your voluntary benefits, and how to enroll. The Joint Chiropractic offers a customized benefits package enabling you to design your own plan, to choose benefits that fit your own needs and your budget. The Joint Contribution has set up a contribution level. The rest is up to you. You decide what you can afford to spend. Now I'm going to talk about as a new hire, not employees that are currently on the United Healthcare plan. As a new hire, through payroll deduction, you can choose from 3 health plans: dental, vision, telemedicine, supplemental, health plan, voluntary life, accident, critical illness, hospital indemnity, and short-term disability. The contributions you make toward your employee benefit plan are deducted on a pre-tax basis. This automatically reduces the net cost of these benefits to you by lowering your taxes and increasing your spendable income. Who can enroll? Employees working at least 30 hours a week, a legal spouse or registered domestic partner, children under the age of 26. You can enroll within 60 days of your date of hire during annual open enrollment. And again, we're only talking today for United Healthcare, and within 31 days of a qualifying event. Let's take a look at the flow chart, which shows your 2025-2026 benefits. Health insurance is through United Healthcare, dental through MetLife, vision through VSP, life insurance through MetLife, telemedicine through Recaro Health, accident, critical illness, and hospital through MetLife. Again, let's take a look at the medical plan changes here. You have a choice of 3 plans. This is effective August 1st. HMO, you can visit any network provider to coordinate your health. Your annual deductible will remain the same at 3,000 individuals, 6,000 family. Coinsurance remains the same at 80% after your deductible. Your out-of-pocket maximum remains the same at 7,000 individual, 14,000 for a family. Office copay remains the same at $15 primary care physician and $100 specialist copay. Urgent care remains the same, $25 copay. Prescriptions remain the same, $10 generic, $40 brand, and $125 non-formulary, and $300 specialty. The monthly rates decreased by 3.3%. So for those that are on the HMO now, you will automatically move to the HMO effective August 1st unless you decide to make a change. Your rate should decrease around 3.3%. Anyone on the core PPO, which allows you to visit any network or network provider of your choice. Now, the core network is a narrow network in your area. The benefits will all remain the same. Annual deductible remain the same at a $2,500 individual, $5,000 family. Non-network, 10,000 individual, 20,000 family. Coinsurance remains the same. Network 80%. After deductible, non-network 50% Out-of-pocket maximums remain the same. Network 6,500, individual 13,000, family, non-network 999,000 for both individual and family. Office copay remains the same, 15 for the primary care and $100 for the specialist. Urgent care, 25 copay. Prescriptions remain the same, $10 copay generic, $40 brand, $125 non-formulary, and $300 for specialty. Monthly rates change from current, also decreased 3.6%. So those of you that are on the core PPO, beginning August 1st, if you don't make a change, will automatically be renewed at the core PPO effective August 1st. And finally, Choice Plus PPO. Again, under a PPO, you can visit any network or non-network provider of your choice. Deductibles remain the same. Network 4,000, individual 8,000, family. Non-network 10,000, individual 20,000, family. Coinsurance remains the same, 80% in-network, out-of-network 50%. Out-of-pocket maximum, network 6,000, individual 12,000, family. Non-network 999,000 for both the individual and family. Office copay remain the same, 15 primary care, $100 specialist. Urgent care remains the same, 25 copay. Prescriptions remain the same, $10 generic, $40 brand, and $125 non-formulary, with the specialty drugs at $300 copay. Monthly rate change, since there's no employees that are currently on the program, there isn't going to be a change in the rates. Here's more of a explanation or overview of the benefits. As you can see here, the HMO, PPO, and the Choice Plus benefits. The HMO, you do need a referral from your primary care to visit a specialist. You can see your deductible, coinsurance. Now, the coinsurance here is what you pay, not what the United Healthcare pays. And then you have your out-of-pocket maximum, your office visits, routine preventative care is covered 100%. Doesn't matter which plan you're on. Outpatient diagnostic lab x-ray, MRI, CT and PT exams, outpatient surgery, inpatient hospital stay, and urgent care facilities. So you can see the three plans here. Just remember that if you're on the core PPO, it's a narrow network. Choice Plus is the national network, so you can go anywhere in the country, network or out of network, but the cost of the Choice Plus is going to be a little more expensive than it is for the core. So you do have the three plans that you can choose from. So let's take a look at some of the voluntary benefits. This is your dental program. You got a choice of two options. Now, again, all the employees that are currently on the dental or any additional benefits, those benefits renew January 1st. So I'm only going to review the benefits for those that are on the plan right now. Those new hires, if you want to get on the dental or any of the other benefits, you can join at this time. So the dental plan, there's two benefits, two options. The first is the basic plan 4, $50 copay for individual, $150 for the family. Benefit maximum is $1,000. Preventative services covered 100%. basic 80%, major 50%, and orthodontia covered 50% with a $1,000 lifetime maximum. Basic plan 5 is a $50 individual deductible, 150 family benefit maximum. It shows here for 2,000, but it got changed to 3,500. Preventative covered 100%, basic 80%, major covered at 50%. Orthodontia is a lifetime of 2,000. Vision, two options. Option 1 is a $10 copay office visit every 12 months, $25 copay for glasses or contacts once every 24 months. The option 2 is $10 copay once every 12 months for the exam, $25 copay once every 12 months for lens or frame, so basically glasses. You can also visit, besides your ophthalmologist or optometrist, you can visit any national PPO directory for or retail change providers for Costco, Vision Works, or Sam's Club. Supplemental life, employees are guaranteed issue to you can select up to 150,000 or 5 times your annual salary. You can also select life insurance on your spouse and dependent children. Spouse is up to 50,000 or 50% of the employee amount, and dependent children is up to 10,000 increments of 2,000. Telemedicine. Next time you are sick and you can consider your options. So let's say you're at your office, you feel sick, but you can't leave. You can call Recuro Health, give them your symptoms, and they'll give you a diagnostic. They'll even call in a physical, I'm sorry, they'll call in a prescription drug for you. So again, you feel sick, call the Recuro doctor, give him your symptoms, and they'll give you a diagnosis, and they'll even call in a prescription. Supplemental medical through SBMA. This is a plan that you can select. It's the cost is a lot less cost than it would be with the United Healthcare plan. There is no deductible. Routine visits are covered 100%. Primary care visit, 15 copay. Specialist, 15 copay. Urgent care, lab services, x-rays, $50 copay. Telehealth is included. Prescription drugs, tier 1, 15 copay. Tier 2, 30 copay. And tier 3, 50 copay. Tier 4 is a $75 copay. The one thing about this plan does not cover inpatient, outpatient, or emergency services. You can add hospital indemnity, which will provide you with benefits while you're in the hospital. Benefits cover both injuries and sickness. Benefits are paid to you for inpatient and outpatient medical treatment received in a hospital, emergency room, and physician's office. Additional benefits include surgery and anesthesia services, major diagnostic exams, rehab facility, and additional lodging. You can also add accident benefits, covers accidental injuries regardless of other insurance. Benefits for both inpatient and outpatient treatment. Covers more than 50 benefits, including hospital admission, hospital confinement, ambulance, emergency room treatment, physical therapy, and it also pays you lump sum for fractures and dislocations. You can also select critical illness. Pays a lump sum upon critical illness once you're diagnosed. Employees can select from 10,000 or 20,000 benefit amounts. Spouse dependent children are offered at 50% of the employee benefit amount. Critical illness benefits are payable for cancer, heart attack, kidney failure, major organ transplant, Alzheimer's disease, Parkinson's disease, multiple sclerosis, and it also includes up to 20 different critical illness benefits. Short-term disability. Maximum benefit is 60% of earnings, not to exceed $1,500. Benefits begin after 14 days of accident and 14 days of sickness. So basically, benefits are covered on the 15th day. So how can you enroll? You will receive a link from your employer or from Franchise Benefits to access your web enrollment. You can complete your registration by creating a password for your account. For those of you that are currently enrolled, you just go back into your ease portal. You will need to verify your personal information, add dependent information or verify it again. Begin the enrollment process. For each benefit, you must choose a coverage level. And again, if this is strictly for United Healthcare, you either enroll or waive your coverage. You continue until enrollment is complete, and then you e-sign your enrollment form. If you get to the end and it doesn't allow you to e-sign, that means somehow you didn't complete, you didn't enroll or waive one of the benefits, or just your United Healthcare benefit. Now, again, remember, for those that are current on the United Healthcare, if you don't want to make any changes, you will automatically be moved over to the new plan effective August 1st. Benefits will remain the same. Open enrollment will begin today, July 25th, and end on July 31st, and there will be no extensions. I want to thank everyone for joining this webinar, and I look forward to helping you. If you have any questions, please reach out to your benefits administrator or give us a call at 800-536-2230, and I am at extension 25. Again, thank you for joining.